Well, good morning, ladies and gentlemen. It's a privilege to address you this morning. My name is Antonio Grillo-Lopez. I'm a hematologist oncologist by training, a doctor, a physician who has taken care of patients for many years, and I have about 50 years experience in clinical research. And I'm mentioning all of this because it's pertinent to today's presentation. I have, like I said, 50 years experience in clinical research. I have a lot of experience with the US FDA and with European and Asian regulatory agencies. In terms of the FDA, I have sat at the table with them, and I have sat at the other side of the table, so to speak, against them, because I have taken a number of drugs for presentation to them to see if they would approve or not. And I have been fortunate to get 5 anti-cancer drugs approved, amongst them the #1 anti-cancer drug for the last 20 years, Rituxan, worldwide, and another 4 drugs that are approved worldwide, plus about 25 other anti-cancer drugs that I have personally been responsible for the clinical development. And I'm saying this not to boast, but to let you know, as you think about what I'm going to talk about, that I have a lot of experience with this, and I know the inside information on what's going on at the FDA. I have sat on their side of the table. I have been their consultant. I have been on the advisory board for the FDA. They named me. I didn't request this. They named me to sit on their advisory board for 3-4 years, sometime in the past. So I know how they work very precisely. And what you hear from me today, you may or you may not believe. But as we sit here today, I have my computer on top of a Bible to assure you that everything that I say is the truth, and only but the truth, as I know it today, from the available information that I have thoroughly researched. My name is Antonio Grillo-Lopez, and I approve of this message. And that's me, for those that don't know me. My goodness.
You look so polished.
So here's the problem. Here's the problem, okay? This is incidence, day by day in the United States. We had that first surge, so to speak, initially after March, April, and in May. It quieted down for a bit, and then we had another surge around July, August. It quieted down for a bit, and now look at what's happening. Every next surge is higher than the previous ones. And we are at a very high peak in terms of incidence right now. And in fact, we have become #1 in the world. North Dakota, in fact, is #1 amongst all nations of the world in terms of incidence, with over 88,000 cases per million population. This is adjusted for population. And South Dakota doesn't want to keep behind North Dakota, so they're #2 in the world. This is compared with all nations. Can you imagine 2 of our states that are not the most populous in the US are first and second in the world in terms of incidence? Why? Because they're not wearing masks. Well, they were not wearing masks. I think now they are. They realize that it is important. And that leads us to deaths, because if you have incidents, clearly some of these people will die. We have learned how to deal with the disease a little bit better, but people are still dying, a significant number. First surge, second surge, and this is where we are right now. The question is, are we going up or not? And the answer is yes, we are. Look at the 7-day average. The number of deaths is going up, and it's significant. So we are involved in a battle, and I have shown you this slide before. It's a very significant battle, the most important battle of our lives, the most important battle, and I do not exaggerate, for humanity today. And you'll see why during this presentation. Luckily, the vaccines are coming around. And the first one, to be approved will probably be Pfizer's vaccine, because this morning at 6:45 a.m. East Coast time, they submitted to the FDA an application for emergency use authorization of the vaccine. Now, how they found anyone at the FDA awake at that time is beyond me, but that's what they said, 6:45 a.m. They probably just left it on the steps outside of the building. I'm not going to talk a lot about Moderna and their vaccine because pretty much they are the same, Pfizer and Moderna. There are minor differences that may or may not be important, but in terms of current results, they are almost exactly the same, okay? I won't go into details of how the mRNA is different one from the other. That's left for another time. Important thing is, as of today, they are almost exactly the same as to results, I repeat. Now, the clinical trial results I have presented to you previously. Let's quickly say that the update is that Pfizer has 43,000 subjects entered. In fact, as of this morning, 43,665 subjects entered into their study. Their efficacy is estimated at 95%. That is, there were 170 subjects that developed COVID-19 after inoculations or after placebo, and 162 of them were on the placebo arm. So that's 95% efficacy. And this is very significant statistically, a p-value of 0.0001. It's very significant statistically. And of these subjects, only 10% had severe side effects. They were grade 3 adverse events, and 9 of them were on placebo and only 1 on the vaccine arm of the study. So the vaccine, good news. It's good, it works, and it will be available soon. And maybe I should stop there, but you know me and my big mouth. This is what's being said about the vaccines. Greatest achievement of the millennium. Discovery has been lightning fast. Development has been record-setting. Manufacturing has been simultaneous with development. Distribution is expected to be highly efficient. Availability is expected to be the earliest ever. And all of this is for the most part true, but there are things you do not know that I will tell you today. Well, maybe not all of it. I'll save some of the secrets for later. The vaccine, here's the bad news. In the meantime, while we were otherwise engaged and enjoying the election or not, behind our backs, this is what happened. We were being duped. We were being duped, people. You'd better understand that. Duped, deceived, and etc. Where in a situation where the data, the information, the status of the vaccines over time should have been pellucid, clear, translucent, clear. It should have been pellucid and it wasn't. You might remember that back in June, when studies of the 3 vaccines that were at the priority #1 list in development, AstraZeneca, Pfizer, and Moderna, they reported their phase 1-2 results. I made a presentation to you and I said, vaccines are approvable now. Vaccines are approvable now. That was in June 2020. My review of the data available then and my experience in the approval of drugs through the FDA and for the use of patients told me that the vaccines were approvable in June 2020. And that didn't happen. Why did that not happen? Well, first of all, I came to that conclusion because when I see a bird that walks like a duck and swims like a duck and quacks like a duck, I call that bird a duck. And that's why I call the vaccines approvable. Why did it not happen? Because simultaneously in June 2020, and believe me, this was not a coincidence. This was made to happen in this way. This was given careful thought and coordinated by the FDA so that they published their FDA guidelines for the development and licensure of vaccines to prevent COVID-19 at the same time, simultaneously with the presentation and publication of the early vaccine data in June 2020. I don't believe in coincidences, and neither should you. And what did they say in those guidelines? That the development programs should pursue traditional approval, that you should dot all the I's and cross all the T's, or vice versa, you should dot all the T's and cross all of the I's, because sometimes they do that. And also that companies should present direct evidence of efficacy, which led to these huge, unnecessary studies that have been carried out at an incredible cost. Do the math. Each patient treated in the US, each subject that received either placebo or vaccine is done at a direct cost of $150,000. If you put together all of the studies, all of the subjects studied in the US, it exceeds 200, 300,000. Do the math while I continue. Tell me later what number you came up with. And they said, the FDA in writing, in the guidelines said, companies will need many thousands of participants. This is unheard of. I have not seen any other guideline where the FDA ever said that the company submitting data to them will need many thousands of participants. In fact, the last drug that I submitted to the FDA and that became the #1 anti-cancer drug in the world for the last 20 years, I presented to the FDA with a total of 300 patients, and it got approved. So I know whereof I speak. Oh yes, they're a bureaucracy. And thus, bureaucracy, the giant power wielded by pygmies, came into the world. And I didn't say that, on Read About Sack said that. It's very important that you understand the US FDA and how they work, because it's not as you think. It's not as you think. The US FDA reports to the Health and Human Services Secretary, but that secretary has 80,000 employees reporting to him, 33 of whom are direct reports. Do you think he even knows the face, the name of these 80,000 employees? He doesn't. ASAR hasn't even met the majority of his employees, much less does he have time to manage the FDA. The FDA commissioner, who has been in place for only a year and had no experience prior to that, Stephen Hahn, who is a very good physician and administrator, is a nuclear medicine physician, actually a radiation oncologist. He has 14,000 employees. Again, he doesn't know all of these people. He can't put a face to a name. He doesn't know the names. He doesn't know the people. He's got 19 direct reports. He cannot meet even once a month with any of them. He might not know some of them. So he is sort of a public relations person for the FDA. He appears on TV, and he's had so much time doing that, TV appearances and public appearances. He can't manage the FDA. He cannot manage it, much less this little section of the FDA, a center, which is one of 15 other centers. And this is called the Center for Biologics Evaluation and Research, who are responsible for the evaluation of vaccines. And let me tell you one thing. The FDA commissioner does not decide how the FDA proceeds on the evaluation and approval of any drug. He doesn't even participate. It's all done below him. at the centers with the people who administer and lead those centers. In fact, even below them, with the people who are the medical reviewers and the statistical reviewers. That, my friends, is where the power lies. Not up here with the Office of the Commissioner, but down here in these centers. These are the people who make the policy, who write the guidelines, and who decide whether something gets approved or not. And that, my friends, is not politics. You have wrongly been led to believe that what's happening with the vaccines is politics. It has nothing to do with that, because these people are not politicians. They are career civil service people. It doesn't matter what party they belong to, they're going to do the same thing year after year until they retire with their good pensions and benefits. This is not politics, believe me. You are wrong. You have wrongly been led to believe that there's politics involved there. It's not. It's what you see in the media, but it is not politics. It's about the power of bureaucracy. And I repeat, not politics. Believe me, it's about the power of bureaucracy. You have been misled. You have been duped. And this is bureaucracy. I cannot present it more clearly. This is bureaucracy, and it's not just the FDA. It's any bureaucracy. Mm-hmm. The FDA tends to be slower. And this is what they have said. As to vaccines, there will be no approval until we have all the data. And underline and highlight the word all. All. And by showing you these skeletons, I mean to impress on you the seriousness of what we're discussing. But I don't mean that the FDA or the people working there are doing this on purpose. This is just their modus operandi. They work this way day in and day out, year after year. This pandemic we're going through is just one more little thing in their day-to-day work. It's something that keeps them occupied, and they always want to see all the data. It's, you know, it keeps them busy. It's security for them. It's power for them. However, every month of delay in approval of vaccine will cost 23,500 lives. Today, it's probably even more than that. And this didn't happen with the FDA alone. The FDA has come by some friends and associates in academic science, in academic medicine, Dr. Fauci being one of them, who has many times stated that, yes, there is a need for all of the data. We need to have, you know, every bit of data before we can approve anything. This is good science. This is good academics. He is not correct. He is sacrificing patients. He's sacrificing lives, just like the FDA is, by delaying unnecessarily all of this. These vaccines could have been approved back in June. I told you so back in June. They could have been approved. Every bit of data that we have today is no different from what we had in June, except that we've come to that magical 95%. One number is all that we have achieved in the last 6 months. It was not necessary. We had enough information that we could have approved the vaccines then and saved lives. The other part of this congregation of bureaucrats, so to speak, all of them, is mass communication. The media has immediately picked up on what the FDA said and what academicians like Dr. Fauci amplified and gave visibility. And the media has communicated this all over the place and duped you. Duped you. You cannot believe the media today. You cannot believe even a person that I respect because he's a good scientist, but he has not had boots on the ground, so to speak, in terms of clinical research. He doesn't know what's happening with boots on the ground. He's up there in his ivory tower, and he knows a lot about viruses. He knows a lot about laboratory research, but he has not had drugs approved ever. And these people were working together And they may not have known, they may not have been aware, because I don't think they did this on purpose, of the lives that they were sacrificing. And if you look at it, this is an unlikely coven. You know, how these people came to be associated is a very interesting sociological and philosophical study. But this is what they did. They put things on the balance, data on one side and lives on the other. And incredibly, for them, data outweighed lives. Data outweighed lives. They sacrificed lives in order to obtain the last bit of information, the last nugget of data, the unnecessary numbers and statistics that sacrifice lives just to get that magical 95%. Were they conscious of the deaths that were occurring, people waiting for the vaccine? I don't think so. I don't think they are bad people, really. They think that what they've been doing is for the best, for the good of humanity, and it was not. It is not, and it's not over yet. So they died waiting. Who died waiting? In the US, 23,500 deaths per month. And it's been 6 months already. And we're going into December. And is the vaccine going to be widely available? No, it will not. It will probably start being distributed and administered to select groups in the spring. And I bet you it will not be widely available in terms of you going to your physician, getting a prescription, going to your neighborhood CVS or other pharmacy and getting the vaccine until middle of 2022. Mark my words, middle of 2022 is when you're going to be able to do that. In the meantime, worldwide, there are 120,000 deaths per month. This is criminal. What has happened here is criminal. There's no way to forgive or forget this. The numbers are just appalling. Makes you want to cry when you look at this. But on the other hand, you know, we need to be optimistic and look at the bright side. We do have vaccines. We have several. In fact, today, Pfizer and BioNTech, who are partners, announced that they have submitted to the FDA for emergency use approval. By the way, emergency use approval means that the FDA can control everything. They maintain control. This is not a full approval. They have to do whatever the FDA tells them to do. No one has told you that either, right? Because otherwise they would have had a full approval. And they do not have a full approval. But anyways, and other companies like Janssen and Novavax are also producing vaccines. Eventually, we will have several vaccines available, and we may stop this hemorrhaging of deaths that are occurring in the world today. And I have to finish with a saying from Albert Schweitzer: good consists in maintaining, promoting, and enhancing life. Destroying, injuring, and limiting life are evil. Listen to this, you academicians in your ivory towers, you at the FDA, you at the median. Listen to this. Good consists in maintaining, promoting, and enhancing life. Destroying, injuring, and limiting life are evil. Stop it. Thank you.